when I should have let myself but I couldn't have. Oh no, I couldn't have. I always open my gut when I shouldn't have. Oh no, I shouldn't have. Win. It's not good. Mate, why did you get into the health scene?
Well, as I was going through high school, I really enjoyed PE. And, as you're progressing into VCE in Australia, what happens is you got to pick, obviously, subjects that you're guided to interest. So I picked VCE PE in year 11, year 12, and the intention was to do high performance. And as I was progressing through university and the studies, I didn't actually enjoy that component of health and fitness, primarily because there was this like robotic mentality around people. Like, they're coming from high performance backgrounds, semi elite professions, whatever it may be. And then your role is essentially to train them up to be the best of the best. But if that falls, whether that because of injury or in play, whatever, then they're dropped. And I didn't like that mentality. So then I diverted more into the rehab scene because I think the general population is constantly at a loss with rehab and at like adaptation to like activities of daily living or, a quality of life that is optimal for them, opposed to someone that's got, money and has that environment and community around them that can be constantly driven back to sport, back to play.
The high performance is a really funny area of our industry, right? Like we do, I think you summed it up perfectly, of Robotnik. We look at them as these machines, like almost like modern day gladiators, right? And it's just like, oh, okay, you're there for my entertainment, and as soon as you stop entertaining me, I'm just going to disregard you as like some spoiler I can take off my car, and then just get somebody else younger and fitter and faster and stronger and throw them all in. I had before I left the UK, like I worked a lot with those folks who were trying to go professional in their given sport. A lot of them were swimmers, and because it's an early specialization sport, they were getting to the realization of like, oh, potentially I'm not going to pay my bills with this swimming thing, with this floating pretty fast thing. Like, what do I do, and who the fuck am I, right? And you get that almost like loss of self, loss of identity, because forever they've just been Chelsea the pole vaulter, Alex the swimmer, whatever. It's like there's no personal identity, right? And then if you actually consider the GPP all the way on the other side, like where's the actual wellness and the holistic approach of anything? It's like, oh, here's a bunch of physio exercises that we're never going to do, and then like crack back on, oh, and drive or sit on the bus to then sit in your cubicle to then sit on your couch. You're like, whoa, hold on a minute. Like, we've got all this money and making so much progress in technology and sport and health and wellness and pharmaceutical, if you really want to put that into the same umbrella. But it seems like in terms of like chronic health, we're falling to pieces. We're fragmenting. And to be honest, that's the main reason why I wanted to have a conversation with you. Someone that is tackling chronic health with everyday folks.
Chronic health with everyday people is a constant battle. And there's two reasons why. One of which is many people don't know what exercise physiology is. And the second thing is, why aren't you giving me like over the counter prescription medication to get me better? So having that holistic mentality of movement as your rehab, movement as your recovery, they're so hesitant at the start. And they're just like, oh, how's this going to help? Or how's this going to fix it? And I think sitting in my position, I'm not fixing you. I'm not. And to put that onto someone is a big responsibility for starters. But it's we are managing symptoms associated to the condition, or we are improving symptoms associated to the condition. It's not, I'm going to fix you and you're going to walk out here and be a completely different person. And I think that's where chronic health, like the health literacy around it, is constantly out of fall. And then you have on the other side of the spectrum where you've been diagnosed with some sort of chronic health condition and that's their whole identity, like their life's done. Like, I'm not going to do anything. I'm not going to put the work in. I'm not going to have some sort of movement or, some sort of management around my life because that's it for me. And it's a battle. It's a battle to be a practitioner in that environment because one, you're trying to essentially sell, your profession to them, and then trying to prescribe exercises or movements that are associated that they may or may not even adhere to.
How do you go about conducting the conversation of, hey, I'm not here to fix you, I'm actually here to guide you, and you have to do the work?
Look, at the start, it depends on the person's belief system when they walk in. Because you'll know as soon as someone walks in, they're here because they're not interested. Like they've got the referral from the GP doesn't really know what to do with them. They're on medication X, Y, and Z. They've dosed it up as much as they can, and this is the next avenue for them. And you can already see someone's nonverbal behavior on they're not here and they're not interested. So I think that's where you need to be really upfront and be like, was your intention of sitting here today for me to give you something that's going to suddenly just make these conditions disappear? And I think being very upfront and ripping that Band-Aid off very early gives them a level of hold on, she's not here to talk shit. And this is for something, I'm going to get something out of it, hopefully. Sometimes it's not always about prescribing medication, or it's not prescribing exercises and a program and progression, regression, whatever it may be. Sometimes it's just actually giving them the advice and go, maybe this isn't for you at this present moment because there's other ailments, whether that be mental health, whether that be financial situations, whether that be some sort of other thing that's going on. Maybe focus on that and then come back to me when you feel that you are ready to do this. Because at the end of the day, you're just wasting your time.
Yep. I couldn't agree more. I've been in the coaching and fitness industry 15 years, and most of my job over those years have been talking to someone to break the belief system they walked into the gym with.
Yeah.
It's got nothing to do with the burpees or the barbells or the fucking exercise selection or the going for PBs or it just honestly just doesn't matter. Just talking to folks and changing a perspective, not manipulating them, but just trying to open it up and say, listen, you're actually believing your own bullshit here and you're the hindrance in your life. You've erected a wall and just said, I can't get around it. I said, yeah, you've put it there and you have to take accountability for that.
Yep. Sometimes it is their own personal beliefs and then whatever's been influenced by doctors or physicians or specialists. If you're going into a clinic room, that person's constantly saying you're damaged, you can't do this anymore, maybe consider a new job or new sport or new profession, whatever it may be. You getting that drilled into you start to believe that. So then when you have someone on the other side of the spectrum going, no, you can do things, they just may be different. Maybe it's just being able to lift the washing basket up now. It's not about lifting a 50-kilo barbell. Maybe we could potentially get to that goal, but let's be more functional in our approach opposed to, I'm done and I'm damaged. And that's the constant speech that you get from multiple people of the general public.
Yeah, it's the comparative curse, right? I'm sure you see it as often as I do, if not more. You see people, they compare themselves to the peak of the pyramid and they're not even on the fucking pyramid. It's hey guys, we actually need to start here. We just need to start. Literally just do anything. Just do anything. Anything is better than nothing right now because you're doing fuck all. Right? And you're like, yeah, but I'm never going to be there. I was like, oh, potentially not, but that's so far in advance that it shouldn't even warrant even thinking about.
Yeah, it's quite it's quite disappointing to see how some physicians go about their like communication with their like patients. Like you can't turn around and say to someone you're damaged and you can't do it anymore. Like there is alternative. Like
Yeah.
I found as well, like if someone's had an injury or like they've been diagnosed with a chronic health conditions, sometimes they're not reflective of look at of all the things that you've done prior to this moment to get this.
Yeah.
For instance, like a smoker, like you've been smoking for 40 odd years. Did you not think that COPD was going to happen? Did you not think that, you know, a poor lung capacity was not was going to happen? So like you can't blame everyone else as well because your behaviors can influence that. If it's a freak accident, like, you know, you can't control that. But if there's things that you've done by choice that have led you to a chronic health condition, that's when you got to sometimes sit in reflection and go, shit, I've put this on myself. Like I'm all on multiple different types of medication because I didn't put the work in when I was told to from the start. Now I'm trying to retrack my steps when for the most part, it's not going to happen. Now we're in this whole management component opposed to erasing it or eliminating, you know, potential other risks that are associated.
For the people that you see, do you find they're open to have those conversations or at least open to hear that information?
Not always. If they've got a very victim type mentality, like, why did this happen to me? I can't believe this is going on. Or they've got other underlying like mental health conditions, you can't exactly have that conversation with them. There are some like patients that you can, those very like rugged, tradie type, you know, manual labor type people, very easy to have that conversation. Or for instance, like past like DVA patients or like veterans of war, people like that, like people that have been conditioned to that environment where you can rip the band-aid off and be very upfront, they can take it and they appreciate that. But there's some people and there's some, you know, dynamics where you need to kind of like beat around the bush a little bit, or you need to be a little bit more empathetic in the approach. So it's like, oh, okay, yeah, maybe this is a reflection of what I've done, opposed to you've done this to yourself. What are we going to do about it now?
How do you go about having those conversations?
They're not easy. Look, again, it depends on the person. Like I've got a patient that had a workplace injury and very old school mentality, like just wants to hear it the way that it is. So it's like, okay, you stuffed up the squat. We need to do it again. And it's not like, oh, I'm going to take offense to that. Where there's some other people that have come from a traumatic, like car accident, for instance, where there's that, you know, underlying PTSD and chronic pain and some depression and anxiety, where you need to be a little bit more like, okay, that wasn't what I was asking. Can we do it again this way? So your language constantly changes depending on the person that's in front of you. Like with a child, you can't give them everything. It's very basic language. It's very blunt language for them to go, okay, I need to pick up the ball and throw it to Chelsea, opposed to whatever the instance is. Like, I need you to pick up a 50-kilo barbell. They're going to be like, I'm 5 years old. That's not going to happen. Do you know what I mean? Like, it needs to be very, very specific to the demographic and very specific to their like intelligence and their mental health like levels as well.
Is this something that you ever learned during your studies, or was this something that you had to almost you're forced to figure this out in real time?
You're kind of forced to figure it out in real time, as well as like your placements put you in different environments as well. So like I've gone from multiple placements where one's like, you know, that semi, you know, elite type sporting mentality where you can grill them as much as you want to because that's the expectation, right? Whereas when you're going into like outpatient, low socioeconomic like hospitals, different way. There's a different sort of language that you need to go about it. It's a little bit more like we got to try and establish a friendship before you can trust me to actually do the exercise or do the movement. Whereas in semi-elite sport, no one's really your friend. They're here to do the job. They want to cut the bullshit out. That's the session for what it is. And then you see him the next time.
No, I love it. I've been in A few positions of privilege where I've been able to just, I guess, teach and pass on a little bit of information. And this is things that I've ended up learning as well as being chucked into different environments. So like, you just have to figure these out for different populaces, like actually, like how to communicate effectively. Like, can I talk to the CEO and can I talk to the author like at the same time? Like, and that is our job.
Exactly.
Quite frankly, in the fitness industry, wherever you end up being, fitness, health, well-being, is to be able to communicate effectively to people. And I find it pretty ironic how, like, the efficacy of our job solely comes down to communication. And no matter how much study you do, we don't talk about communication.
No, at all, at all. All that I remember when I was doing my masters, all that I remember this like clinician slash lecturer saying, you need to have empathy. That's all that was constantly drilled. You need to be empathetic. You need to be empathetic. And then like, okay, yeah, it's all good and well there, but that comes with boundaries as well, because sometimes depending on the person's, like whether they're on an insurance claim or they're doing like some sort of compensation or even their personality, sometimes they can take advantage of your empathy and make it out like it's a joke as well.
Yeah.
So they can run with a story and then you're obviously believing and going, oh shit, like, maybe I'm being too harsh. Maybe we're not doing the right things. Maybe we're not reaching goals, whatever it could be. But then you sit in reflection and go, hold on a second. What are they actually doing beyond this? Maybe they're doing nothing. So like, you got to try and play ahead of the game and go, okay, if I put as much as I can in this half an hour or 45 minutes in this session, I know that I've done the best of what I can, and whatever tools and strategies I've given them, you just hope for the best that they're actually taking it out of it.
Yeah. Yeah. It's welfare of the clinician too, or it's welfare of the coach too, right? Like, you can't go home and stress about it all night and not get any sleep. And did I give this? Did I give that? No, like you've got to, yes, do the best you can. Like, I'm definitely in that boat, but at the same time, like, you got to put your own oxygen mask on first. Like, do as you can and then get out of there.
Exactly. And I think like depends on the person. Like I learned the hard way, because when I was fresh out of my masters, I went into NDIS mobile. And that's like, yeah, you go from one extreme to another. And I was burnt out bad. Like, you're there, plus I think because you're a new grad, you're trying to prove yourself. Like, I do know my stuff. I do know what I'm doing. So you're constantly driven on that. And then when you reach a point going, I'm taking literally all these issues home with me, something's got to give. And as you like develop from a new grad and you're getting a little bit more settled in your profession, whether it be coaching, whether it be EP, whether it be physio, then you start to be familiar and go, you know what? I can only do as much as I can in this session. That's all. If it's not going to happen then it's the next session. Or it's, I've done the best that I can. Whatever's going to come out of it is on the other person. Whether they're going to go and do their exercises, whether they're going to train, whether they're going to eat healthier, whether they're going to do, some sort of mental health strategies, whatever it may be, that is on them at the end of the day. You can't be responsible for everyone.
What was that switch? Where did it occur? What was it like? What was the feeling? What was the journey like? That switch of, you know what, I do know my things. I don't need to prove to myself anymore. And I'm going to do the best from 0 to 60, and 61, I'm gone.
The switch was actually getting out of the job. Because when I was in the NDIS scheme, you're constantly report writing and proving, this person is unable to do something or this person's meeting goals. There's a constant roundabout scenario of proving what's going on. It wasn't until I was out of that job and go, you know what, I do know what I'm doing. I do know what's expected of me. I don't need to constantly try and word things differently just to prove my point. Just be as blunt as you can be. Someone will accept it, some people won't. That's just how it is. So it wasn't really until I was out of it to go, you know what? I know as much as I know, and I'm going to take this as a learning experience into my next environment and just take it from there.
And where's that mindset come from? Is that something that you've always had? Is that something that has been developed, passed on, taught?
I would say that it's been developed over time. I wouldn't say that I was like this when I was 15, 16, 17 years old. I think in that environment, you're very much, I need to be like everyone else. I need to, be conditioned to my environment. I need people to like me. I need my peers. I need friends. I need this. Like there's a lot of needs when you're in those developmental stages. Then when I clocked into university, I'm like, you know what? I don't need to be friends with everyone. Like this is on me now. Like if I want to study, this is on me. If I want to put the work in, this is on me. So then as I was developing in it, I think the independence started to really push me through it. Then as I was going through like workplaces and having a boss like telling me what to do, I started to really hate it. I'm like, I don't like you telling me what to do. Like I know as much as I know, and that's about it. So then that's when I actually pulled away from like, you know what, I'm doing this on my own now. Because I'm in charge of it. I can drive it. I don't need you to tell me to skewer the person's like goals or skewer the report so it suits you because you're going to have this person for another 8 weeks because you're making money off it. I'm going to do it my way because things need to be met. Goals need to be met. And this person needs to either be back on the path or back to work or be able to conditionally be able to lift up their grandchild. Like there is end results. I shouldn't have a patient for X amount of years because it's a pocket thing. That's where it started to really sink in and go, no, we're going to start differently on this one.
I think that's a beautiful transition over to functional mind, right?
Yeah. That's how functional mind got started. I just got really sick of like big corporations and clinics like taking advantage of their patients. They're going in 6, 7, 8 months later, and it's like, what have you done? Oh, I'm still doing sit to stands. 8 months later, like you should be able to do a back squat. You should be able to do a front squat by that point. Like you shouldn't just be going up and down by a chair. Like that's where it starts to be like a bit ridiculous. And there is like some situations where people are in that, or they're like, oh, I've been seeing the physio for, X amount of years and all they've done is, massage my back, but I still can't, create core contraction or core activation, or I've got no pelvic control. So then that's when like from a coaching perspective or an EP perspective, you're like we're starting from foundations again.
The amount of conversations I've had, Chelsea, and I'm sure you're going to understand this, of people like, all right, guys, any injuries, any problems, any niggles, anything I need to know about? It's like, oh yeah, my shoulder. I said, oh yeah, Sam. What's about your shoulder? Oh yeah, this, and this. Oh yeah, Sam. How long? How long have you been having it? Oh, like 3 years. And you're like, okay, don't you think that highlights we're doing something wrong? Or let's just even say we're not doing something right because it's not getting better. Like, what are you doing for it? Oh, I saw the physio for 2 years, but it didn't really do anything. I said, you saw a physio for fucking 2 years? Like, mate, what is going on?
Exactly.
You're not questioning these things? Like, are we not got? I don't know. I don't know what the fall off is here. To be honest, whether it's ignorance, whether it's arrogance, whether it's people just so stressed out that they just want to go. I'm going to go see Chelsea. I'm going to pay her money, and whatever she does, whether she does something or doesn't do something, I paid her money, so that's ticked. That's a to-do list ticked. I can move on to the next thing. I was like, yeah, but what? Assess the efficacy. Did it work? The answer is no. Then potentially we could try something new. Like, I'm okay with being wrong.
Yeah.
I'm not okay with being fucking ignorant about it.
Exactly. I think like some of it comes back to the health literacy. Like some people really take advantage of that. Instead of educating their patients or their clients as the reason why we're prescribing this or the reason why we're experiencing this, like they don't do that. Many people don't do that. Where I think like if we're going to reverse roles, I would want to go into this clinic room or into this gym and know that you're going to educate me and I'm going to walk out of it and go, okay, I know the reason why you've prescribed this. Instead of, oh yeah, like I'm just doing some banded work, but I don't know A, which muscles are activating, B, the reason for it, and C, I'm not going to be doing this for the next 6 to 8 months. I think that's where it shifts. And like some people have that power trip as well, where it's like, well, you're coming to me so I can do as much as I can do, or I'm going to like drag it out as long as possible because I know that you need me. You need me, really. So you're going to feel great. You're going to, have a few stretches or you're going to go through mobility or you're going to get massaged. And then I know by, in a fortnight, A, you haven't fixed your posture or B, you haven't activated what I've asked you to do, you're going to be back right here, aren't you? So again, that's another income. Where my mentality is like, I would rather have the reputation to go, okay, Chelsea has taught me this, this, and this, but I don't need to see her anymore. She's progressively become redundant in her position, meaning that we've done as much as we can in, the approved referral numbers or whatever it may be, but now we're going to transition back to reality.
Mm-hmm.
That's where I think that's, the avenue that it should be going in.
I completely agree. And to be honest, I don't understand the mindset of, oh, I'm going to make them dependent on me. Like, yeah, okay, in terms of money, it's going to be a consistent income, but it's boring as shit.
Mm-hmm.
Like, it is batshit boring. Coming in and just rubbing someone's low back for 45 minutes and then say, okay, see you in 2 weeks. Like that, there's an easier, quicker, and a better way to make a buck.
Exactly.
Like we got into this thing. I don't want to say to fix people, but to teach men and women how to fish, to bring horses to water. Right,
Yep.
I'm going to bring a horse to water twice. I made that decision. If you walk off, I get it. I understand. We've all relapsed in some sort of way. I'm going to go find you. I'm going to grab you by the scruff of the neck. I'm going to bring you back to that watering hole. And then if you wander off again, that's on you.
Yep.
Because now that's taken away from the time and energy that I have for other folks that haven't had that opportunity yet. And that's my job, to bring it to water. Maybe you're the watering hole. Maybe you're going to teach them in more depth. Maybe you're going to bring them back. We've all got our own role, right? But you can't just be like, okay, like I see this person 3 times a week and they've had no fucking progress or whatever, and I just ask about their missus on the weekend or their fella on the weekend, make them laugh. I was like, mate, just go be a stand-up comic if you want to make people laugh. Like, just do something different, mate. Like we're in the business of helping folks, and there's a lot of people out there. There's a lot of people out there that need our help. People feel stuck. They feel lonely. They don't know what to do. Like, they've got this chronic pain that they've just been experiencing, and they believe that waking up with back pain or waking up feeling like absolute garbage mentally, or a chronic migraine, or passing out because of pain once a month is just normal. It's like, it's only normal because you've just ignored it for the past 10 years. Doesn't mean it's normal.
Exactly. Or what will happen is they'll present their concerns to the GP and be like, this has been going on, this has been going on, this has been going on. And it could be like 3, 4, 5 years of lingering pain. And then they come and see you and you're like, so what are you diagnosed with? Oh, just chronic pain of this, this, and this, and this, and this.
Yeah.
It's like, well, there's a lot more to it though. Like, have you experienced, obviously it's not in my scope, but is there a mental health outlier? Have you experienced a trauma? Have you had a car accident? Have you had something that's been going on quite, whatever it may be? Or is there potential stresses that are influencing this? Or is this just physical? Like, there's got to be an answer for it. Like, I had a patient that was coming in saying, I've got chronic neck pain, I've got whole body joint pain, I've got lower back pain, all of it, but nothing. And then you're just like, okay, but are you is this fibro symptoms? Like, do you have fibromyalgia? Do you have chronic fatigue? Do you have this? Do you have that? Have you experienced a trauma? Like, is there things that we're not really getting to? And the patient's like, I've never gone to a rheumatologist. I've never gone to a neurologist. I haven't seen a psych. It's like, well, so you're coming to me for the physical component, which I'm appreciative the referral is there. But at the end of the day, we need an answer as to what's going on. Like, you can't be living life of, I've got A, B, C, and D, but we haven't gone through the right avenues to actually know that. They've just stamped you with something and you're on your way. But you actually haven't gone through no route to go, okay, maybe this is because of my mental health. Maybe this is because there's actually something underlying physically. But there's been no actual, I don't know whether it's care or there's been no actual advocacy to do that.
Yeah, I think it is down to us who are already within the industry, and, I guess we're just practitioners, right? Me on the bloody dance floor and you doing the real work, but actually coming together as more like a spider web of like just purely the physical is not in one web. No, we've got the emotional in there, we've got the mental in there, we've got the buddy GPs in there, right? Like I speak to a lot of I've had the privilege of I guess helping business owners in terms of gyms and upskilling coaches and all that. And I said, do you have a relationship with the local GP practice? And they're like, why would I do that? I was like, do they know you exist? Like, why would I do that? I was like, you're in the same line of work. Hopefully they know your name before they know the doctor's name. But they don't. It's actually the other way around. I'm going to go to the doctor and get my fucking codeine and my goddamn whatever else and take it 3 times a week for a million years before I'm going to go in and like try an air squat below parallel, because that sounds like hard work. You know, like maybe it requires us to talk to each other a little bit more. And that's why, to be honest, I take a lot of accountability of like, hey, coaches on the floor. And one day I hope I'm able to, I don't know, create a fucking something. I'm just like, we need better questions to ask folks, to highlight some red flags, and also have an absolute understanding of something that is not in our scope of practice, which is a lot. So we're like, okay, we also have a referral system. We got an EP, we got a psych, we got a GP. We have all these people that we know they're fucking good at their job. And we have all these questions that are not just a bloody park you. Like, that's not good enough. That's just contraindications of exercise. Bring them in, right? Man. Now, are they chronically stressed? Are they fucking this? Are they that? Are they that? And if there's enough red flags that go on, we need to be able to refer them to someone. And in my, I guess, euphoric vision, be like, we'd have a spider's web of it no longer costs people money too. They're in some sort of syndicate, some sort of system where they've already paid into and they can just be referred off and go around, and we can actually tick these boxes and you get information from the psych team. You said, okay, well, that's been ruled out, right? Sound. So maybe I can think a bit more of this. Or the site gets, okay, that's been ruled out. Chelsea's done her job here. Now I can go a little bit more here. But we don't. We like it's a competitive, money-driven business where it's like, I need that one client. And I had beautiful experience they got given to basically to MC. Crazy. I think they fucked up. They gave me the role to MC a couple of events of a congress, of a coaches congress, right? They fucked up somewhere. They gave the guy they gave the mic to the wrong guy and said start talking to him. And I said, listen, they're not going to understand what I'm saying. There's no subtitles on this mic, and I said I basically just finished the last 2 days, and I said, guys, like, you know, you've come here and highlighted that community is a great thing, because look around, there's everybody else around you. And you've highlighted that we've got a hell of a lot more to learn. Like there's, if you take the whole number of all the gyms, all the PT studios, all the EP practices, all the everything, and you just fully load them. I can't take any more clients. I can't have any more members, right? And you add all those numbers together, I guarantee you it's not 8 billion. So there's people out there that we need to help. We're in cooperation, we're not in competition. And if we're able to almost change the tide of the health industry, it's not fucking big pharma, right? It's actually like, how are we going to help our local community? Because if everybody helps their local community, isn't that a global community?
Exactly.
But
I just find it.
All that. You just not me just like I'm blonde, I'm fucking crazy. I've had too much caffeine. It's hot. I don't know what I'm doing.
It's very interesting that we've all come into this industry to help people, but they like, then you're in it and it's such a business driven mentality.
Yeah.
Like there's gate kept information, like there's competition between an EP and, you know, a physio or an osteo or, you know, the specialist, and you're sitting back and it's like funny when we were going through this and it was so driven to, we're going to help everyone. And then you're in it and you're just like, half the time you're not.
Yeah.
Like half the time you're constantly in battle with like the insurance company to prove, you know, why this person needs more sessions, or you're in competition with the physio because the physio is not prescribing what you think is like more adequate to the prescription and the recovery. And it's just like, you're actually baffled by the end of it, because you're like, I didn't think that it was going to be like this toxic maybe, or like so displaced. Like we're supposed to be interdisciplinary, but we're not. It's like, oh, I need to send another letter to your GP to ask about this, but I'm never going to get a response. Or I'm going to send a letter to the physio and give them an update that, I want to work collaboratively with you, and then don't respond. And you just like, you sit back and you're like, you got to be kidding me, right? Like, is this not supposed to be focused on the person that's got the referral and that's sitting in your room, not my profession or my personality or how much I know or how much you know? Like the end goal is to get this person back to some sort of activities of daily living or some sort of function. That's the end goal. But you gatekeeping information or, not corresponding with me about what's going on creates more issues for that other person. It doesn't create issues for me. I'm frustrated, yeah, but I'm on to the next person. I'm on to the next patient. But that person that's coming in and day out, or week by week or month by month, whatever the appointments is constantly out. But they don't seem to realize that, or they do and they just don't care. I don't know what it is.
What is it? An obsessive need for greed, an obsessive focus on money. I guess I get a little cynical when it comes to that. And you just like, people are just obsessed with money, and I got to make more money than you, and that's just not the case. And whenever folks go to, maybe it's yourself, maybe it's a physio, maybe it's an osteo or something, with something chronic, right? Not just something acute, like something pretty chronic. I say, okay, do us a favor. What? Go get a diagnosis. Oh yeah, I can ask that. I said, no. Also get them to either write it down or print it out. Like, don't even tell it's for me. Like, just say it's for you, because they're more than happy to help the patient, the client, the member, whatever you want to call them. But if you say it's, oh, my coach wants to know, they'll get a little funky about it. Oh, yeah. What's he want to know? I'm just saying, okay, what line of thought? I want to know where their brain is going. They're going to know more about these things in this regard. There's potentially some things that I'm going to know a little bit more about. How do we work collaboratively to help this individual?
Exactly. Sometimes they're a bit weirded out when it's like, oh, the EP requested this, or the physio requested this, or the coach requested this. So then, like, the way that I word it's like, at the end of the day, if your name is on that document, you're entitled to that result.
Yeah.
And then when they sit back, they're like, oh yeah, you are right. Like, I can have that copy. I'm not going to understand it. That's always the answer. I'm not going to understand it, but I'll give it to you. Maybe you can tell me. Well, then that's the way that we're going to go about it. Instead of me going, hello, my name is this, and this, and I'm from here. Can you please give me the results? Oh, why do you need it? And then it's just like that whole conflict going on there. So it's like, well, you know what? That's the way we're going to approach it. You're entitled to that. You're entitled to have these results. You may need them in the future. Who knows? But at least you have that copy. I will interpret it the best that I can. And at least we have some sort of diagnosis or some sort of prognosis moving forward.
Correct. And isn't that our job, to be able to understand some pretty complex theories and then be able to dissect it and communicate it in a way that a 5-year-old could follow? Isn't that our job?
Exactly. I mean, that's the way we got taught, but it doesn't seem as though many are following through.
Honestly, like, yeah, most of the time is, how do we simplify things?
Exactly.
Like, and I honestly believe, the more the way we simplify things is to understand it in a deeper level, to genuinely obsess over it and just throw your mind as deep and as far into this thing as possible, so you understand every avenue. Be humble enough to ask other people's opinions as well, and understand their little niches in this whole conversation. And that way we can break it down and we can actually communicate it to the everyday folk. And I don't know, maybe we can help a bit more people. Maybe.
I think that's essentially the end goal, really. And I think if you're pushing forward that mind and body link and it's interrelated, you're already halfway there. Because if someone is coming in low mood, tapped out, highly stressed out, very heightened, whatever the presentation is emotionally, your body shows it. And I think when you start to educate that and go, you're stressed out today, aren't you? They get taken back by it. They're like, oh, no, I'm all right. And then they start to, my kid did this and this happened and I got stuck in traffic, whatever. It's like, I already saw it. And they're like, what do you mean? Look at the way that your shoulders are. Look at the way that you've come and you've presented yourself. Like these are the non-verbal cues that are already there. Then that's when they sit back and go, oh shit, like it is a mind-body interrelationship. Like there is certain things that are happening to me internally that externally it's coming out. But it's, again, you need to simplify that for him to go, you know what, when you're stressed out, your shoulders elevate, or, you know, you're very rigid in your movement patterns, or whatever it may be. That's when they start to link it up and go, okay, now I know. Now I know, okay, maybe I need to, you know, regulate my central nervous system as a foundation and then get into the loaded components. So you got to start to, again, like you said, start to simplify all the education that we've got, so then it's replicated better.
Bridging the gap between mental and physical health, right?
Exactly. That's the end
Funny.
goal.
Funny that.
That's always the end goal. But I think it's people that have got a holistic approach and personally have that holistic mentality can link it very easily. Where some people can just not interrelate it at all and go, what do you mean? Like, oh, because you're sad, your body's like this, or because, you know, you're stressed out, your body's like that. Some people can't link that up. Where if you are practicing that even externally from all your profession, everything, it's a lot easier to educate it.
Yeah, I agree. And honestly, Chelsea, the more I think about these things, the more we need folks with soft skills and are naturally empathetic or have a tendency to be a bit more empathetic within the umbrella that is health and fitness, because we can understand a little bit more of the wider scope of everything that is entailed: mental, physical health, emotional health, sociological, like everything just kind of in the mix. And there's folks that just aren't like that. They just don't tick like that. And that's okay. Like I spent many years confused, annoyed, like why, how the fuck, what are you doing? I was like, you know what? They have, you know, they've got some roles and expertise in places that I can't do. So I'm going to love them and appreciate them for that. And I'm going to help prevent them walking across the road because they're a little bit daft, and stay clear of these things. And maybe I'll be the street smarts and they'll be the book smarts, but we're going to get through this thing together, right? And I think it all comes down to a bit of cooperation with everybody in our field, outside of our field, people on the street, strangers, like just being a bit more open to folks, maybe.
Exactly. I think so. I think, like, at the end of the day, like, the way that I treat may not suit everyone, right?
Yeah.
Same thing, me as a person externally from my profession may not suit everyone. That's just how it goes. So that's
Yeah.
why there's so many different personalities and there's so many belief systems out there, because you'll end up finding where you sit best. And that comes from our profession as well. You may not, out of the 10 referrals, maybe only 6 of them will stick because your personality gravitates to them. And the other ones need the really hard driven ones. Maybe the other ones need someone that fluffs around a little bit about the information. They need that because that is what they're conditioned to. And that's okay.
Mm.
You can do that. You need to think in a selfish way, maybe, that I need to get an environment that best suits me. And that's okay. Like, it's not a bad thing for that to happen. Just like relationships, the same thing. Like, whether they be, you know, we may not link on particular beliefs and morals, and that's okay, because our upbringings and our, you know, our external environments is what influences that.
Yeah.
Doesn't mean that's it. Like, there are other niches, there are other environments, there are other communities where you will find someone that is very similar to. It just takes, you know, time. It takes a few duds. It takes a few experiences. Like, that's just how it goes. It's the same thing as when I have a patient. They may have 5 different really shit EPs. Now you're the best one.
Mm-hmm.
Same thing as a coach. You may have some really shit coaches. Now you're the best one.
Mm-hmm.
So that in retrospect, that relates everywhere. It's not just because, you know, we work in health and fitness and I'm a clinician and you're a coach and whatever else. Like, it works everywhere. It works in every demographic. It works in every environment.
Just because there's been a few duds, I'm going to remember that for a while.
Yeah. It's a good one.
That's class. That's class. Honestly, the way I think about these things, Chelsea, is leave people in a better position than when you found them. And
Exactly.
like, I genuinely hope that the next person to take my role does it better. I hope that the next coach does it better. It's just that, did they arrive to the next place in a better position than they arrived to mine? The answer is yes, I've done my job.
Exactly. Or if they've reached a goal, however, how simple it may be for them, how big it may be for them, if they have reached that, you've done your job. That's why you sit in the initial consultation or the initial conversation, go, okay, what are your goals? I want to be able to do this. I want to be able to go back to full-time work. I want to be able to lift my grandkids up. I just want to be able to go to the shops without having a whole entourage because I can't lift and carry the groceries. Beautiful. Let's do it. At least we know it. So then by the time, however many weeks or months or whatever the like timeline is, when they've reached that, you sit back and go, you know what? We've done the work together. You've done it. I've done my job.
Mm. What drives you to get people? Might sound like a bit of a crazy question.
That's okay.
But what drives you to get people the goals that they initially sit down and tell you that they want?
In what way are you trying to
Like, if someone
ask that?
says, sit down and says, okay, Chess, I want to go to the supermarket on my own and lift all the groceries. At the moment, I can't. I got this pain or whatever. Like,
Mm.
why are you so? Because I can hear it in your voice. I can see it. Why are you so motivated to get that person there and then to almost shift them on? I don't want to say kick them out, but like, you don't need me anymore. Like, what makes you so motivated and driven so much to be able to do that?
Because I think function is power. I think if I'm able to do something independently, I can do that. I'm not reliant on other people. So being able to functionally do something is probably the most optimal a human can be. Whether it be that it's a little bit modified and you need like a walking stick for assistance, or you may need a trolley for assistance, whatever it may be, that is there to be utilized. But you're doing it on your own and you've got your independence that creates some sort of quality of life. That is why it's so driven for me. Yeah, it's pretty deep, wasn't it?
Man, I love it. Function is power.
I just like, from personal experience as well, like I've seen what it's like to have a workplace injury and to see all your independence be gone. I've seen what that looks like. And to like that's a hard reality for someone to live in. Whether they be impacted mentally, physically, like to have your independence stripped away from you, that's what influences your mental health. That's where the identity crisis gets like influenced, the depression, the anxiety, the stress, like whatever it may be. That's all coming down to because I'm not functionally able to do things that once I used to do with ease or once I used to do out of love and out of interest.
It's funny because one of those biggest times in my life ended up pushing me more towards someone that I actually am. Like, I write books, right? I write poetry books, and people say, "Well, that's a bit of a weird thing to do. Like, you're in the fitness industry or have been for a while, and you write fucking poetry. What are you? That's kind of weird. Like chalk and cheese." And I said, "Oh, at 18, I actually broke my back, and I couldn't move my legs." And it's like, well, if I can't express myself physically, like I'm fucked. At the time, I was fucked. I had nothing to do. I literally couldn't do anything. I'm like, well, I've got all this going on. Like, well, what do I do? And you end up falling into these other things, right? So you talk about function is power. Like, you get that stripped away from you. It gives you some pretty hard realizations, some pretty hard questions and conversations that you have with oneself. And yeah, it kind of makes or breaks you, right?
Exactly. And I think if you're going into it like as a clinician or as a coach, if you've got that positive like reinforcement, we are going to do it. However it may be, whatever assistive tools we need to do it, but we're going to do it. That's where the mentality starts to shift. Okay, Chelsea's got that, that deep interest that we're going to do this. And then they start to believe it. And it's not to talk shit and go, okay, no, we're going to just do it. But you put the work in, you do those steps, you reach small goals. Like, these are expectations for yourself as a clinician or a coach, as well as the patient or, participant, whatever it may be. I just think, like, at the end of the day, you need to be realistic about it. And even if that means, okay, we are going to use a walking stick to go into the shops and, walk around the center, or you are going to use a trolley for assistance just because of a balance element, whatever it may be. But at least they're still doing something. It's not like, oh, my life is over now. Like, that's it. I can't do it anymore. No, you can do it. We just got to do it a different way.
I got a question. It's a little different. What's something that you don't care about that you used to?
I don't care about people's opinions about me anymore. I was so driven on, this person needs to like me. I need to be the best one at school. I need to be the best one at my job. I need to be the best one in my social environments. Like, that was always in the back of my head. And I think that comes always down to the level of acceptance. Like, if you're not accepted, you always feel displaced. And then as I was getting older, I'm like, you know what? I don't need everyone to like me. I don't need people's opinions to drive who I am. I know who I am. I know the interest, and I know my worth in this environment. I know what my calling is, to help people and to manage, like, their chronic health conditions or whatever it is. That's where I sit. I don't need to prove that anymore. Whereas when you're like younger in that developmental stages, you're constantly like, oh, am I good enough? Do I sit best here? Are these people good for me? Is the popular person going to accept me? Whatever it may be. But then as you evolve, you're like, that really means nothing. It really means nothing. If I know who I am internally, everything else will fall into place. And I will go into an environment and in a community that will accept that.
Don't you think that's the true manifestation? Knowing who you are so strongly that what is aligned to you and what is meant for you ends up presenting itself to you.
Yes. That always comes back to, if you didn't put the work in and have those experiences, you wouldn't know it either.
Absolutely. Absolutely.
So yeah, it does. It definitely comes back to that manifestation.
Chels, this has been an honor and a privilege, mate.
Thank you for the invitation.
Thank you very much for talking shit with an hour with a stranger. I understand it's a weird thing to ask somebody. Hey, do you want to like talk to a stranger on the internet? Like it's strange, it's weird, but honestly, this thing was birthed out of like by accident, genuinely by accident, and with a genuine want and a desperate need to help folks. So thank you for offering a little bit of your expertise.
You're most welcome. Thank you.
Sharing some time. Appreciate it, mate. Have a good day.
You too.
Bye, everybody.